Well, Snohomish County leaders say it's highly unlikely that the county will be ready for phase 2 of reopening by June 1st. The county says it's still seeing too many new cases to meet the state's threshold.
So as you can see, while we've made significant progress in flattening the curve and seeing the number of cases decline, and even in the past week or two, we're down to, maybe in the high teens, 15 to 20 cases per day over the course of the week, whereas we were at 25 to 30 2 to 3 weeks ago. So things continue to get better, but we're still not there.
So phase 2 allows restaurants and salons to open. County leaders say it's possible at some point next month, but won't be by the 1st. So more than 1,000 people have died from coronavirus in Washington state, and experts say the state's death toll could actually be 2 to 3 times higher. Health officials say they've identified 3,000 deaths dating back to January 1st that involved symptoms associated with COVID-19. Those patients were never tested because it all happened before the first case was identified in the state. Officials are revisiting those deaths to determine whether they should be added to the total. Well, Reuters reports Fred Hutch is heading up a massive testing effort to try to get a vaccine available to the public by the end of the year. More than 100,000 volunteers will test half a dozen vaccines. Vaccine makers have agreed to share data and lend the use of their clinical trial networks to competitors in order to get it done. And tomorrow, coming up after Meet the Press, we have an exclusive interview with the president of Fred Hutch about this and much more. Meantime, new research questions the use of hydroxychloroquine as a treatment for COVID-19. The medical journal called The Lancet published the study. Researchers looked at data from 96,000 patients hospitalized with the virus. It found patients who were treated with the drug were more likely to die or develop heart problems. President Trump announced this week he's taking hydroxychloroquine as a preventative strategy. But as with all coronavirus treatments, scientists have not been able to prove that it is an effective therapy. A new syndrome in young people may be linked to coronavirus, and it makes all of us parents very concerned. It's called multi-system inflammatory syndrome. And our state health department says at least 2 children, 1 in Snohomish and 1 in King, currently have it. King 5's Tony Black tells us more about this new and rare condition.
Teresa Lawson says her 13-year-old son Anthony is out of the hospital today, but is still very sick.
We assumed that our son had allergies because that's, he had a little bit of itchy eyes and, just felt a little punky.
Earlier this month, Lawson says her normally healthy son also had dizziness, a rash, and a fever. An initial coronavirus test came back negative. Then he got worse and ended up at Children's.
We met him in the cardiac ICU, where we were told that it appeared that he was in the middle of heart failure.
What he had is called multi-system inflammatory syndrome in children. It's a rare disease that was first reported in the UK and various U.S. states in April. On Friday, Washington state health officials announced a second confirmed case, this one in a child under 10 years old. The child is out of the hospital and home recovering.
The numbers of these kids with these symptoms has increased at the same time that COVID-19 has come along in the world.
Dr. John McGuire is from Children's, where both cases were treated. He says parents shouldn't panic as it's still not clear exactly how coronavirus is related.
So there appears to be at this stage some association, but we don't know a direct causation.
The CDC put out a health advisory of symptoms including being under 21, being hospitalized with inflammation and multiple organ sickness, and a positive coronavirus test or exposure to a confirmed case, and no other plausible diagnosis.
We are still in the very early stages of understanding this, what appears to be kind of new syndrome. So far, the reports are very favorable. Our experience with a small number of kids has been that they're recovering.
Tony Black, King 5 News.
Tony, thank you. Meantime, Governor Inslee, he is not standing down after the president told all states to reopen houses of worship this weekend. President Trump calls them essential.
The governors need to do the right thing and allow these very important essential places of faith to open right now for this weekend. If they don't do it, I will override the governors. In America,
so the president said he directed the Centers for Disease Control to issue guidance for churches, synagogues, and mosques. Now, Governor Inslee's director of communications responded saying, quote, the governor's office continues to work with spiritual leaders and health experts to identify ways to do this safely. While we have read the president's comments, there is no order, and we think he understands at this point that he can't dictate what states can or cannot open. And now NBC's Meet the Press moderator, Chalk Todd, he tells us about other challenges ahead for the Trump administration.
As all 50 states begin to ease restrictions, the Trump administration seems to have moved on from mitigation and is now focusing almost solely on a vaccine. Some promising news about vaccine trials emerged this week, but many challenges still lie ahead. I'll talk to two experts about how soon Americans can realistically expect a working vaccine. And as governors balance the health risks of reopening, they are dealing with constituents who are increasingly divided along party lines on when and how to do so. I'll talk to Republican Governor Mike DeWine about reopening his state of Ohio on this Memorial Day weekend. Plus, after months of protests in Hong Kong, China wants to try to crack down and proposes a new national security law that would essentially threaten Hong Kong's independence. I will talk to National Security Advisor Robert O'Brien about how the administration plans to respond and whether any response can stop China from doing this. It's all ahead this Sunday on Meet the Press.
All right, so be sure to watch Meet the Press tomorrow right here on King 5 at 6 a.m., right before you hopefully tune into us at 7 o'clock.